And I wanted to welcome everyone to the COVID-19 School Health Support Grant. Before we get started, I am here with two of my colleagues, and so I'll make some room for them to introduce themselves. If Matt or Corey want to come off of mute and go ahead and introduce yourselves. And we'll move
forward. Good morning, everybody. Matt Lashley. I'm Chief of Staff for the Department of Grant Compliance and Administration at TEA. Happy to be with you this morning. Thank you for attending.
And I'm Corey Green. I'm the Associate Commissioner and Chief Grants Officer for Grant Compliance and Administration here at TEA.
Great. Glad they're joining me because they are our grant experts here at TEA, although I'm Damon Hall, the Senior Operations Project Manager here, and I am the Program Manager for this particular grant. I've got my colleagues here to support as well, just so we can come together as a village to help support everyone. So we're going to go ahead and move forward. We do have quite a bit to cover today. From 11 to 12 will be the bulk of the presentation, and then we have that additional 30 minutes till 12:30 to as a Q&A. Because I'm sure there'll be quite a few questions that we want to make sure that we get through and support you all if you're in the middle of applying or still on the verge of applying, or you've applied and are wondering about allowable costs and so forth. So once again, welcome. So this is our general disclaimer. This presentation is intended solely to provide general information and guidance to participants and reflects the TEA's current understanding of presentation topics applicable to federal guidance. The content of this presentation is subject to change. As a result, further potential information and guidance provided by federal agencies with regulatory oversight of this or other programs. This presentation does not constitute legal advice, and participants are therefore advised to seek legal counsel regarding information and guidance provided in this presentation before acting on such information and guidance. So that's here if you want to come back and refer to it. So for today's agenda, we're going to cover some brief session norms and reminders. We're going to look at accessing the session materials. I'm going to give you a little bit of background about the school health grant, because I know there might have been some confusion between this and the other COVID-19 grant. So we'll get through that. We'll talk about eligibility requirements and considerations. We'll talk about the funding and allocations, allowable activities. We'll actually go through the grant application so that you all can walk through it. We'll look at some reporting and compliance and monitoring bullet points there and just kind of briefly go over those. At the end, we'll provide some resources, and then we'll spend the rest of our time today looking through and going through the Q&A. So we're answering your questions live. If not, as we go through, you can also type within the Q&A chat feature. So session norms, kind of just touched on this one. Please use the Q&A feature at the bottom of your screen to ask questions throughout the presentation. We will have time at the end, but Corey and Matt are on here to also help answer and fill those questions. Save yourself some time and use the keystrokes. So if you see a question that's similar to yours as the same question, you can use the upvote feature and it'll go to the top and be prioritized to ensure that we get to that question. So please use that feature. We will address Q&A at the end of the webinar, covering most frequently asked upvoted questions. So that's that thumbs up feature. At the end or at the top of the list. We'll answer those at the end of the webinar. We will address as many questions as we can. We may not be able to get to all of them. I'm sure we won't. So any questions we don't have, we have a way where we can pull the questions. We'll add them to our FAQ. And then if you've emailed COVID case, I know some of you have, we're making sure that we're going to get all of those answered within the next 1 to 2 business days before you all go off for Thanksgiving break. So I wanted to share that. And then last norms and reminders. This session is intended for the school health support grant and things related to that grant. This is not a public health session or talking about other grants. Now, if it relates to this and you need clarification, that's one thing, but we definitely want to stay focused on this grant. A recording of this webinar and the PowerPoint slide deck will be posted tomorrow on our website, and I'll show you the website in a little bit by 5 p.m. So if you want to go back and review it, or you have some colleagues that want to see it for themselves, it will be posted, this recording as well as the slide deck. So you can print out the PowerPoint if you need to. Big reminder here. So City of Houston Schools, and I'll click on the spreadsheet in just a second. You all are currently being supported by TEA for antigen tests. That is true through the K-12 COVID-19 project. But you are considered part of the Houston Health Department CDC grant. The city of Houston got its own grant. That health department got its own grant of around $69 million. As such, these districts are not eligible for this grant. We're supporting with antigen tests through the vendors, but in terms of these extra allowable costs and pulling money down for that, we would not be supporting you, but the city of Houston will be supporting you. So for those who are wondering, who are those schools? Let me pull that up for you. I'm gonna bring that to the side here. It'll let me, here we go. Move this out the way, move this over. Actually, let me just pull it here. Here we go. Thank you for your patience as I navigate this Zoom. Here we go. So here are all of these schools. This is also posted on our website. There's 148 of them, public and private, that are listed. If you want to know, that list is actually on our website. If you go down here to K-12 COVID-19 testing project, it is listed on our website. You can find that same list of City of Houston schools. It's there. So if you are on that list, you would not be a part of this particular grant. So just wanted to make that known. All right, back to the presentation here. But the Houston Health Department will be supporting you. They do have a mechanism, and here it is right here. I want to go to that. So if you're one of those 148 schools, they do have a mechanism, which is right here. If you're one of those schools from Houston, you can put your name, fill out this document, and at the bottom, they ask what other services you need, and then they'll be able to support you with those additional allowable costs. So they do have a resource there, and we can drop this link in the chat. It'll also, this link will also be provided on our website as well. So I'll drop that in the chat. Okay, so, and let me drop that now in the chat for everyone. What I just put in the chat is the City of Houston link for those that are eligible for that grant. Okay, moving forward. This is accessing materials. So throughout this presentation, I'm going to refer to quite a bit of information. Everything that I talk about is posted on our website already or will be posted within the next 1 to 2 business days. So I really advise you all to go ahead and bookmark this link. And so I'm going to click on it here. It's a link that I was just in. It's to the website. At the top, you'll see this. But if you click on COVID-19 School Health Support Grant, it takes you to all of the material that's already posted. A lot of the information, but the bulk of it is here. Definitely go there. We update this information pretty regularly. You'll see the dates of when things were last updated here. So please bookmark this link. If Mattercore could drop that in the chat, that would be great, because this is what you will be referring to between now and when you apply, and then even after you apply for the grant. So wanted to make that known that we do have quite a bit of resources already available for you. So that's what those are. Moving forward here. So background, want to just touch on the background of this grant to kind of align everyone on what we're talking about here today. So the U.S. Department of Health and Human Services invested $10 billion from the American Rescue Plan to enable schools to establish a COVID-19 screening testing program to support and maintain in-person learning. So they wanted kids back in schools learning, so they put out this grant. Texas, the state of Texas, received just upward of $800 million, about $803 million. Those dollars flowed through our state health department to administer. So what TEA did is we partnered with the Department of State Health Services, DSHS, to be sure that we could provide resources and provide a grant that would be really helpful to schools based on feedback we got last year through our COVID case email and through the previous testing programs. We wanted to provide what we felt based on your feedback would be the most applicable to you all to help support staff and students on your campuses. So within the $800 million, $221 million have been set aside so that eligible, and I stress eligible there, and we'll get into that, public and private K-12 school systems could pull down money for additional allowable costs. Those include additional testing services, ventilation, and vaccination access. Now, Some are probably thinking right now, but isn't there already a grant where we have allocated funds where we can go to the vendors that you all have listed? Yes, there's two buckets of money. One side is we've allocated money for schools, public and private. And you can find that on our website as well, for you to go to our 3-4 vendors, and I'll get into that later, but just a general overview where you can get turnkey testing services, either direct PCR antigen testing or for them to come in and actually do the testing for you. You go in, you use that allocation to request those services from those 3 vendors. They bill dishes, the state health department. You all are not billed. You just sign up, make sure you're eligible, and you can get those services and use those allocated funds. That's one side. The other side is what we're talking about today, the $221 million, which is what you would pull directly funding to you that you would then use these allowable costs and then be reimbursed and so forth, cash advance and all of that, but we'll get there. So I wanted to just distinguish between the 2 different parts of this $800 million. Vendors for testing, direct funding from the $221 million. All right, and I already said this, DISHES and TEA have already partnered to ensure that we can provide these funds and these grant services for public and private eligible school systems. And Corey and Matt, feel free to jump in if you want to add or clarify something, just in case I misspeak. So the goals of these programs, I kind of already touched into this. The first one, the goal of the K-12 COVID-19 testing project is to provide needed resources to implement COVID testing programs for related prevention on your campuses. So that's the vendors. Once again, that's the vendors. That's that part. And that application is still open as well. This part is this application that just opened on November 4th, the 221, for further services that are not directly related to testing, or they're not directly testing or testing services. So that's what that is. So eligibility requirements and considerations. So I'm going to pause and let you all read the screen first, and then I'm going to touch on some things that I feel like are extremely important. I saw something pop up, so I'll answer this now. It is not too late to apply for the vendor side of this. You can go and apply for that now. That application will remain open till Thanksgiving Day, and we're going to pause it and it'll open back up January 10th, but I'll get into that too. So on here, who's eligible? Public and private K through 12 school systems. If you have pre-K on your campus, as long as those students and staff members commingle with K through 12 students on your campus, that's fine. So for instance, I used to work for KIPP. KIPP has a pre-K 3, pre-K 4 on campuses with K through 5 grades. That's fine. But if you are a standalone early childhood center, pre-K center, daycare center, you would not be eligible. You have to be on a campus with K through 12 students, staff. So that's the distinction there. I've already talked about this, but the city of Houston, if you're amongst those 148 schools, you would not be eligible for this part, but this Houston Health Department will be supporting you. We dropped that link in the chat already, and it'll also be posted on our website. Lastly, we had a webinar today from 9 to 10:30 led by my colleague, Matt Lashley. That webinar will be posted in that slide deck tomorrow as well. But if you are a private school system, because that webinar was about this, going over the regulations for private schools. If you are a private school system and you choose to apply for this grant, you accept these funds, you will become a recipient of federal assistance, making you subject to specific federal requirements. So once that's posted tomorrow, you'll be able to see that webinar in full if you didn't join it, and that slide deck, and you'll be able to see all of the federal regulations and just all the things that pertain to, as a private school, accepting these funds. So wanted to say that there. So funding allocation. So how do we determine what schools get what? How much do you get for these allowable activities? So allocations for public school systems was based on a rate of $38.57 for every student on your campus ages 3 through age 21. And the reason we have 3 on there through 21 is because some campuses have pre-K 3 that commingle, and we know that some schools have students that are a little bit older for various reasons. And so that's what we based it on, and it was from the most recent PEMS data. That's what that was based on. And it's just students, not staff. So 3857 times the number of students within your school system. Now, private school allocations will be added to our entitlements page after all the applications are accepted. Because TEA, we don't govern, we don't have necessarily jurisdiction over private schools. We don't know all the private schools that are going to apply. So once December 9th passes and we have that full list of who's applied, we will then do the formula and then add or post a separate list for private schools. So that's why you do not see that posted yet. Now, you might be wondering, well, where is it posted? In two places. This allocation is already posted on our TEA entitlements page, which is right here. And Corey and Matt can drop that in the chat. It's also already on our other website, the the COVID-19 School Health Support Grant. It is right here under correspondence and notices, where it says School Health Support Grant allocations by LEA. It's the same one posted there. So it's already posted if you want to see how much you've been allocated so that you can plan accordingly. So it is there for you. All right, I will move forward from here. Remember, once again, the application deadline is December 9th, which is about 3 weeks, is actually 3 weeks from today. So you have about 3 weeks left to fill out the application if you want to participate in this particular grant. So allowable activities. So I know this is probably where the bulk of questions will come from. And so let me pause. I know many of you have seen this before, but I want you to read through it again. So I'm gonna pause and let you look through these 9 allowable activities. All right, PPE is allowed. Masks, gloves, gowns, face shields. It's not limited to those, but it's PPE. Hygiene, cleaning supplies, your Lysol, your different things like that. Portable, high efficiency, particulate air HEPA fan filtration systems. I want to emphasize something here, portable. It also says other small items. So replacing your HVAC system is not allowable. But if you wanted to get filtration systems that are portable, that are smaller, yes. Because we've gotten a lot of questions about on this particular one. And so we just want to be very specific about what portable and what small means. If you have a particular question, you can ask, because I know there's nuance there, but just a general rule, think smaller, think portable. Public health events that include students and other community members that are aimed at providing opportunities for increased detection and prevention. So if you wanted to do an after school event for your parents or for community members on the weekends or during the day around COVID prevention in the home or wherever, and you're doing it on your school campus, you can use some allowable costs for those type of events. So yes, that money can be used for those type of events, similarly to vaccine promotion events and communications. So right now we know that 5 through 11-year-olds have now been approved to get vaccinations. So a lot of you might be vaccinating or promoting vaccination. If you're promoting the events, flyers, any kind of communication, you're holding the event, those type of things, you can use these allowable funds, these allowable activities for that, for those type of events. COVID testing, test kits, turnkey testing services, and related support. I got several questions, and the team got several questions in the COVID case inbox about this. Well, if you already have allocated funds for the vendors, why then would you have it over here? This is why. Many schools, we have 3 vendors we're working with on the other side of this grant, the K-12 COVID-19 testing project. We're working with Quest Diagnostics. We're working with Thermo Fisher. We're working with Achieve Health Management, and then Affinity is a FEMA one, but they're related, but not necessarily related. Those are who we're working with. You might already be working with a vendor that you're very satisfied with, and you want to stay with that vendor. You can use that vendor and use these costs to pay for those services with that vendor that are COVID testing services. So that's why. Or if you look through our vendor sheet, which I'll get you on the next slide, and what's there, you prefer something else, you can then seek your own vendor and use these funds for it. So it's to open it up so that you're not limited to just those 3. They do great services, but we know Texas is a huge state. You might want some other vendors to work with. Cost obtained from the CLIA waiver. Yes, it was $180 for you to get the CLIA waiver if you've already applied for it. You can use this money to be reimbursed or to pay for that CLIA waiver. Here's another one, partial funding for staff who will be conducting grant-related duties. And Matt, I might lean on you on here for you with this one. Testing for COVID prevention programs for outside staff regular duties. So this is what this is for. This is for supplemental things. So if this person already has a job, already has their regular duties, and they're doing additional duties outside of what they normally would do, that's COVID related, then yes, you can use funds for that. That's what this is for, not to supplant, to replace everything that they're doing, but to supplement. Let me pause there. Matt or Corey, did you want to jump in to add on to this one?
No, I think we're still gathering questions in the Q&A so we can tackle allowables together. We're letting them get upvoted, but it is, like you said, supplemental and partial. Key indicator here is this isn't a grant that would cover salary for staff inside their normal hours. So you really want to judge it against meeting the specifics of the grant and outside their current duties if it's existing staff.
Got it. Thank you, sir. And then other allowable uses pre-approved. So there might be some things that these 8 just don't qualify, that don't cover, and you think it might be. That's fine. Send us an email to COVID case report or to the grants team. We'll look at it and we'll let you know if it's approved or not approved. One last thing on this slide, pre-award costs. You might have, if you've seen it, it is allowed from May 1st up until the day you apply, or up until December 9th. So pre-award is permitted if requested from May 1 of this year through the submission of your application or through December 9th when the application deadline closes. So want to move forward here. This is the vendor sheet here. Once again, what I would suggest is we have this posted on our website. I would suggest look through the vendor if you have a resource sheet that we've already provided for you all that we're working with. Look through all their services, see if you like it or not like it, or if it fits the specificities or the nuances of your school district. And if it does, proceed with it. If it does not, then look into outside vendors through this grant. So I'm actually going to click here. And what I want to do is actually go to our website. If you go to our website, and I know earlier we were here, right? And this is for this grant, if you just scroll down a little bit further, you will see the K-12 COVID-19 testing project header right under the school health support grant. If you just keep scrolling down and you go under tools and templates and resources, the vendor resource sheet is right there. And so just to give you a closer look at to what that looks like, I'm going to pull it over just so you can see it. This is what that looks like. It was updated, last updated on 29th, but it might have been sooner, but here is the Excel doc. Achievement Health, Affinity, Quest, Thermo Fisher. If you keep scrolling, it has everything there for you. And then you can reach out to those vendors. So this is already on the website, just to let folks know. If you're looking into vendors right now, you want to compare and contrast outside vendors of these. So I'll go back to my presentation here. There we go. So that's that piece. I'm gonna move further. Last thing I will say, if you choose to go with school systems that decide to go with vendors outside of those offered by the state, will need to adhere to the mandated reporting requirements. Those requirements will be posted on our website because we still have to report those things to the CDC because these funds would still be used. So you still have to, there's still certain things we have to report. And so we're going to post those requirements on our website within the next 1 to 2 business days for you all so that you'll know if you use an outside vendor, what will be required there. And actually what I'm going to do is I'll give you a sneak peek of it really quickly since we're all here. Since we're here, I'll give you a sneak peek. Here's what it looks like. It'll be something of this variation. So you'll have to do the week ending, the school name. You'll have to go in. We're looking to know the number of tests conducted for PCR, antigen, other things, number of positive tests, and so forth. But we'll have this fully up and running. This is just a template overview of what that'll look like. But you will have to submit those reports. All right. Move forward here. So a couple other things that I have not addressed when it comes to allowable activities. What I wanted to do is go to our FAQ. So we have an FAQ posted on our website. If you click here, if I click here, it's going to take us to that FAQ. We've already answered a couple of questions. We are going to be updating this with between today and tomorrow based on all of the questions we've been getting. And so it's already here, a lot of the questions. Do we have to take part in the testing program to apply for this grant? So there's been questions about, do you need to apply for both? Yes, if you want to participate in both, they're both federal grants, you have to apply for both. Just because you're on the vendor side does not mean that you're in this part of the test. I'll get into the timeline in a second. We list allowable costs. We talk about partial funding, the $880 CLIA waiver. We talk about private schools for federal funding. We talk about things that are not allowed. And then we get into some reporting. So wanted to touch base on that. And then one other thing I wanted to do, and actually, let me do it this way. Let me go there again. There are a couple of more questions that came up when it comes to allowable costs and some FAQs. Pre-award, we already talked about that. From May 1st until the day you submit up until December 9th is allowed. This is supplement, not a supplant grant for allowable costs. Another frequently asked question is, let me see which other one is here I wanted to address. Is there a PDF version of the application? Yes, we posted the actual application and a PDF version of the application is on the website. If you submitted your application already and want to make adjustments, can you do that? Yes, you just resubmit the application, email us at COVID case, and we will make sure that we take your most recent application and void the original. So that's that. And yeah, so I want to make sure I touched on those commonly asked questions. So with that said, I'll get back into the next slide. Generally speaking, for allowable activities, when you're determining what's an allowable activity, here's a general statement that, or rule of thumb that we stick by. Any allowable use of funds to be charged to this grant must be reasonable and necessary. The grantee must justify the use of funds to the intent of the program and statute, and the grantee must align it to an allowable activity noted in the program guidelines, which we'll get into in the application. It is the responsibility of the grantee, which would be school systems, public and private, that choose to apply, to maintain proper documentation to justify the use of the funds. The reason we say that is because the CDC could audit this. And so if they want to investigate or look further into an allowable cost that was applied for, we just want to make sure that you all have your proper documentation saved so that you can show why it was allowable or why, justify the use of the funds. So just want to put that out there. Now, grant application, some key dates to remember. This grant was posted and sent out to the larger public on November 4th. So a couple of Thursdays ago, this was put out there. So it is live right now. You can apply right now. The deadline is Thursday, December 9th, 11:59 p.m. That's 3 weeks from today. So you have 3 weeks if you've not applied to apply. January 14th will be the first cash advance grant payments initiated. Unrequested grant allocations will be reallocated. Thursday, March 31st, 2022, grant end date. May 31st of next year, grantee closeout day, final grantee expenditure documentation due to TEA. And then as a state agency, we need more time to button up all of our documents and so forth so that we can report that to the CDC. So our closeout date is June 30th, 2022. These dates are also in the TAA that was posted on our website. So if you're looking for, and I can show you that now. If you're looking for where that's posted, you go back here to our grants website, you go to the TAA, all of those dates are right here. So once again, it's in the PowerPoint that'll be posted, but it's also in the TAA that's already been posted. So those are there for you already. So just let me go down to where we were, which was here, current slide. Let me scroll through. All right, now I'm gonna go through our grant guidelines. I'm not gonna go through every single detail, but I wanna go through some basic things here. This is also posted on our website. If you go here, back to our website, under here, the grant guidelines are posted right at the top, this same document, so that you could read it for yourself as you're filling out the application or if you're deciding whether you want to do this or not. So key things to know about there's obviously a table of contents at the top, but some key things here I wanted to make sure we touched on. I'm the program contact here. You can reach me at COVID case report at ta.texas. Myself and a few other folks have access to that. And so we're getting through the questions and should be all cleared out, and everyone should be answered within the next 1 to 2 business days if you've been waiting. Talks about the program purpose and goals. We've already covered that. It talks about eligibility. I've already talked about that. The one thing I did leave out was this earlier. ESCs may serve as a fiscal agent to a shared services arrangement or SSA. And we'll get into that during the application. So that is also allowable. So public, private, eligible, and then ESCs as an SSA. And then within the guidelines, there's hyperlinks to more details if you need more details for each of these sections. I already talked about this. For general supplement and not supplant guidance, see here, but the supplement and not supplant provision does apply. So this is a supplemental grant, not for supplant. I already touched on that. Direct costs. TA permits applicants to budget reasonable and necessary direct administrative costs for this grant. Indirect costs are listed here. LEAs can claim the maximum for indirect costs equal to their current approved indirect cost rate. The LEAs are public school systems to know that. If you're a private school and you don't know your indirect cost, general rule of thumb is here. Private schools may claim a maximum of 8% of indirect costs authorized, and it gives you some more details there. This is getting into requirements and assurances. Won't get into all of that. Statutory and federal requirements, you can read that. I don't want to bore you with that. But definitely read through that, because as you're applying, you're saying that you are going to adhere to these things. Under the statutory and federal requirements, then there's TEA specific program requirements. So as you apply, you're saying you're going to adhere to these things as well, to all of these bullet points under there. We get into allowable activities, which we've already covered. Unallowable activities, federal grant requirements. So that's all here. I definitely advise you all, if you haven't already read through this, it's not too long of a document. It's about 11 pages to read through it, to educate yourself before you apply for a grant, and you're responsible for what it entails. So that is the program guidelines that are there. Next is the application. So we're going to go through the application. As I mentioned, some folks wanted to know, was there a preview of the application posted before they applied or before you apply? Yes, that preview looks like this, and it's posted on our website. Once again, notice I keep going back to the website, because as you get questions, my suggestion is check the website out first, see if it's answered, and then if it's still not, reach out. But definitely trying to just save you some time and efficiency there. If you go here and you go under tools, templates, and resources, the application is there, and then that preview PDF version is there. So it's all there for you. All right, let's look at the application. Let me blow this up a little bit. So when you open the application, it is a Qualtrics application. This is the only thing it will be. Won't be e-grants, it'll be here. Here is the first cover of it. Authorizing legislation, required federal funding notice, the grant dates, and all of that, pre-award, all of that's listed up front. When you click next, it's then going to ask you who you are. Are you an LEA, which is a public school district or charter, all the same, private school system, or are you an ESC serving as a fiscal agent for SSA? I'm choosing LEA because that applies to most people on this webinar today. When you go there, you will first have to choose your ESC region. Once you choose it, it's going to automatically populate every school system within that ESC region. So it's very simple for you. You click it, and it'll put your school system number, CDCN number afterwards. Let me go back really quickly. If you're a private school, it's going to look like this, because we don't have jurisdiction over you. We don't have your information. So you're going to have to fill out some things that are a little bit longer. This is what it looks like for a private school. All right. And then if you're an ESC, I've already kind of filled that out. So let me jump back. Let me go back to LEA. I chose Edinburgh. I'm going to say I'm Brooks County ISD. Next is going to ask this. And these are already pre-populated to save us some time today. I went in and did that. primary contact person. So who do we need to reach out to if we have questions about this grant? You put that person, put their email address, their number, and then we need a secondary contact. First and last name, their email address, phone number. Now, if you leave out one part of these fields and you press next, it will not allow you to. We set it up that way because you need to fill out all of this so that we do not have gaps in your application. So if any time in this application, you leave out a mandated field, you'll get this little notice. Please answer this question. So I'm just going to put back in a dummy phone number here. This is just for you all. Put in your real numbers, obviously. And then it says shared service. If you are SSA shared services arrangement, if you choose yes, it's going to ask you to list all those planned SSA members, including CDCN number, TEPSAC number, all of that. It'll list it, and it gives you up to about 20. So you'd have to list it and your grant allocation number, the grant allocation amount that you're looking for. Let me go back. I'm going to say no because I'm going through as an LEA. Next, it's going to go through certification and incorporation. You're saying that you understand the application, what it constitutes, what it offers. As you fill this out, you're saying that, hey, I am adhering and I fully understand these things. It lists 5 different statutes and certifications and things that you need to adhere to or acknowledge that you've read. So we've made it easy. If you click here, it opens it up for you. Each of those, let me go to it. Let me go back. There we go. Let me open it. Here it is. If you open it, it gives you that first website. So it gives you the grant guidelines and application. So it takes you to our website. If you go to lobbying certification, it takes you there and gives you what that looks like for you to read. And so for each of these, but you get the drift. If you just click on it, it'll take you out and pop out so that you can read it before you actually check it, which I advise you to do. Next, certification and incorporation acknowledgement. Authorizing official name. This person is saying that they have been authorized by your school system, public or private, to fill this out on behalf of that school system. So you should definitely check before you fill it out that you've been authorized by your school system to fill this out. Because if something happens, not to be negative or whatever, this is who we're going to look to answer questions or be our first point of contact. So just understand when you're filling this out that it should be the person who's authorized to do this. You're going to put your name, your title, your email address, and phone number. I just put an X here, marks the spot, but you can literally type in you're going to draw in your signature there. So we've made it pretty official, and this will pop up and we'll have this in our records once your application is submitted. So you do sign for it, and then you put the date. Little note about the date. If you type in the full name, let's say 18th, 2021, and you press next, it's going to let you know they need it in this form. So you need to do it as month, date, and year. So that's that. Next, statutory program assurances, some more. There's several boxes there. I know it's a lot here, but this is a federal grant, and there's just things that we have to adhere to. Many of you are already familiar with as you've done federal grant applications before. So make sure you read through each of these, check all the boxes. Once again, if you leave off a box, it'll say, please answer at least 12, all of the choices. So it'll let you know you got to check them all to say that you're fully aware of what you've been reading. Next, this gets into instructions to fill out the allowable use of funds. I am going to go through these really quickly. Complete the section below separating costs of allowable funds noted below. Grantees are allowed to expend grant funds on the following activities. Check the boxes to indicate the activities upon which you intend to expend the grant funds and enter an estimated expenditure for each activity. All budgeted amounts must be entered into a whole number. Do not use cents. So you just round to the nearest dollar. It doesn't, no cents, you just round to the nearest dollar. If no grant funds are being used, meaning that you're not going to use that part of that allowable cost, you just put a 0 in that field. LEAs, the total all allowable uses of funds must be equal to what you've been allocated. So if you were allocated 200,000, you can't request $1 million of allowable activities, obviously, but I'm just putting that out there. And then we have a link to the entitlement page. So if you don't know, hey, I forget how much we were allowed, you click here, it takes you to here, and then you can go and look up your allowable cost that way. So we try to embed it to make it easy for you all to go through. And what I would suggest as you're going through, do right click and open into a new window. That way you don't have to toggle back and forth. You can see both windows versus having to click back to go to the application. Private schools, we already talked about this, 3857 is the rate amount that you should use. SSAs, the total of all allowable uses of funds must be the total of all predetermined allocations. And so that's there for you. For budgeting assistance, see budgeting guidance, we've offered that here too. You click there, it'll take you to that budget assistance. So I've kind of already gone in and filled this out, but it lists all of our allowable costs right here for you. So it's listed, and you just put, if you're doing, there's two columns, pre-award. So what are you claiming from May 1st up until the date you apply? And then what are you saying from the date you apply up until March 31 of next year? And you're just gonna put what you spend or what you plan to spend. And I only picked number 6 and said 2,000. So at the bottom, I put 2,000. If you're not using it, or if you don't wanna, if there's nothing there, you just put a 0. You have to put the 0 there or it won't let you move forward in the grant. So if you're not using it or there's nothing you want to put there, put a 0. There is the money, you put it there, and you're going to put it to its whole dollar amount. So just round to the nearest dollar. And then for number 9, other allowable uses, you fill it out and then just type in a brief description of why you feel what you want to request is an allowable cost. It's just not 1 through 8. One last thing I'll note, we've updated our application. So if I were to refresh this, you would see that this now says vaccine promotions, because we wanted to make sure it aligned with the other allowable costs. So we caught that glitch there. So you'll see that the allowable costs are aligned across all of our documentation. So I'm going to go forward. Then it goes into budgetary pieces. It breaks it down. Class and codes, payroll, professional contractor services, supplies and materials, other operating costs, capital outlay. It defines it for you, because we know it's a lot, might be new. It just, once again, so that we're all aligned on the same language, it defines each of these terms for you. And as you go below, you fill out that piece. And then it talks about indirect administrative costs, which you kind of already talked about in the guidelines. For LEAs, you already have a predetermined amount. And then for private schools, you can claim up to 8%, no more than 8%. So I just said 2,000, put 2,000 at the bottom. And then if I said I was an LEA that wanted direct cost, when you're filling this out for direct cost percentage, you do not need to put a 0.05 or anything, just put the percent. So this is 5%. If it was 7%, you put 7. So that's how you do that. And it gives you that direction in, or gives you that note in the direction here on the caption. I'm gonna go to next. Indirect administrative costs, private schools only. So if you're a private school and that applies to you, you click it. If not, public school, you move forward. Equitable access. Check the appropriate box below to indicate whether any barriers exist. The applicant assures that no barriers exist, you can move forward. If you say barriers exist, it's then gonna prompt you to list the group in the barrier. If you say no barriers exist, then when you go here, it'll say that your application submission, and we've added this because we knew that a lot of folks are like, it doesn't have a submit button, so I didn't realize I was submitting. It now says submit application. So you'll know. If you don't want to submit it yet, you want to put it on pause, just go back. It won't submit until you submit it. So that is the application. And then once again, there's a preview of the application also on our website. And both, once again, are listed there on the website. So last couple of things, and then we're going to jump into this Q&A. Statutory requirements. This is a hyperlink back to the guidelines. So you can go to our guidelines and read what those statutory requirements are. I did that. So in case you're looking at the PowerPoint, you can do that on the slide deck. The key things, sorry about that. The key things I want to touch on for the scope of this presentation for reporting requirements are performance measures. So our reporting requirements are covered in the grant guidelines, which I've already kind of shown you where those are, under statutory requirements, TA program requirements, and performance measures. But performance measures provides the clearest indication of what's required, which are the monthly reports, the fiscal monthly reports, and then possibly an annual progress report that we'll have, and we'll make all of this known to you well in advance so that you have time to submit it on time. So these are the three basic things you're looking at: monthly reports around activities that you're using the grant for, monthly fiscal reports, and then possibly an annual requirement of an annual progress report at the end. Resources. Types of questions: grant questions, COVID case report, best practices, COVID case, public health, although we didn't want to touch on that too much, test coordinator here. Anything else around testing vendors from the other grant, that would go to our friends over at Dishes at TCEC support at Dishes right here. So these are the two main email addresses that you can email. Please, just another note, if you've emailed us in the last week or so, everything will be answered by close of business tomorrow. I'm just a little backlogged and trying to get some clarity on some allowable expenses. So if you send an email, it's not that we're ignoring you. We just want to make sure we get you the right answer, but you will be answered and good to go by close of business tomorrow. Once again, accessing our website, already gone over that. When in doubt, go to the website. If not, email us at COVID case. Here are some other resources here. TA grant opportunity, general fiscal, all these other things that relate to our grants. These are all hyperlinks. So you can come back here. If you don't know where to go, come back to the slide deck. If this fits the topic you're looking for, the resource, click on it. It'll take you to that website. And then lastly, these are some outside resources for you. Open Safe Schools. This is just guidance around best practices when it comes to COVID and as you reopen your schools. This is a test calculator. When should you COVID test? It's a great resource. And then the CDC school testing toolkit that has a lot of resources for school systems. So we tried to provide you all as much resources internally to TA and externally that we felt were helpful and could be of a good resource to you. Last notice is right here. I'll let you all read that. It's another notice that we're required to do. And so now, because I see we're up to 77 questions in the Q&A. So I'm going to shoot now over to the Q&A and we'll spend the remainder of our time today. We have until 12:30 to answer questions. So I'm going to pause because I've said quite a bit. Matt or Corey, do we want to jump in with some of the top questions?
Yeah, we can. I will just note, I think folks are doing the upvoting. Encourage folks to go into the questions. You can hit that thumbs up if it's one you want an answer to. We're going to take them from the top. So for this, two things to note. We'll typically answer these live because it's recorded, and then we'll capture all of this and work with Damon to post written guidance on these in the FAQ. So general answer for allowable uses of funds will be this could be allowable if it's on the list, but it's going to rely on justification. So we may not be able to be as specific as you would like in some of these questions, but go ahead and vote up the questions you want to see and we will take them from the top. The first one I want to answer is right at the top. When you order, do we have to receive the items by March in the grant? You do, but there's a bigger issue here you want to be mindful of. In a grant, you must receive the services or goods during the grant period and liquidate within the 90-day closeout window. In addition, and this is in our general fiscal guidelines, relates to some information in there under the procurement section. This is a one-time funding or a grant. Any late orders that are received at the end of a grant could appear to be stockpiling and could be an audit finding. So what this means is if you're going to order goods and services, you need to make your best efforts to have those received and used to benefit the grant program in that period. We realize this is a short timeline for a grant. We're doing everything we can to work with our partner agency to request a no-cost extension, but you can't simply receive things right before the grant ends and that be allowable. That could come up in an audit finding. It has to benefit the recipients in the grant period. So we realize that's difficult in March, but if it comes in at the end of March, you could be opening yourself up to an audit finding of allowability because the goods or services weren't received. Again, that's linked to the general fiscal guidelines. That is pretty common guidance for all grants, but a good question. Timeline can make that more difficult as well, but something you want to consider. I just want to note, we still have folks putting questions in chat. We won't see those if you don't move them to Q&A. Please move them over to Q&A. Can we pay for the salary for custodians who provide services, open, unlock buildings, set up clinics at vaccine clinics? This is outside the regular job. This could be for overtime pay. We will ask this particular question, but generally under number 8, there is allowability for partial funding for staff if they're conducting grant-related duties for screening, testing, or COVID prevention, and it's got to be outside the regular duties. So generally, this means it needs to be either outside of their regular paid hours. So for a custodian, simply opening or unlocking the building during regular school hours would not necessarily be supplemental. If they're doing some extra duties for any of those other allowable activities, it could be allowable. Again, with all these allowable items, we will get more FAQ guidance, but you will have the burden of documenting this, that you need to document and justify allowability, including time and effort records, what they're doing, the duties, just like we would with any other federal grant. So generally, yes, that could be allowable under partial funding number 8. But again, we're going to capture these specifically and get written guidance out through the FAQs as soon as we can as well. Do PPE items purchased for inventory need to be distributed to campuses and departments by grant end date? They do need to be used. This could still be stockpiling. So they need to be items that are used. I can't say for sure, how many or how much, but similar to the first question, you can't use this grant simply to stockpile PPE if it's not used to benefit in the grant time period. I do want to note for school districts, there are other funding sources with a much longer timeline under S or other programs. So a program like this may make you want to consider the allowable uses of funds here in the timeline where you may be more strategic. But to purchase for inventory, you would expect that at least some need to be used during the grant period. It can't just be held just for future mitigation. But we can also post that question to be sure. Corey, I don't know if you want to add anything. PPE is often stored, and you've got that look like you know a little bit more than what I offered.
Yeah, you may want to consider using this grant for items that you can use quickly. Even if you may have originally planned to use your ESSER funding for those items, you may want to use this grant and then redirect your use of ESSER funds for other things that you have if you haven't expended those funds yet. But you really have to watch. We know this is a very short-term federal grant, and this is very unusual for a federal grant, but you still have to follow all the federal rules. So you have to receive the service in the grant period. And so you may want to consider specifically how you use these funds for those allowable activities that you can ensure you're going to receive that benefit during the grant period. And if that means using some other fund source for other uses where you have longer life on the money, you may want to look at all this. You need to look at this grant in conjunction with all your other pandemic funding and look at the big picture.
Yeah, probably the most important guidance on allowability we can offer there, which some of you are accustomed to with all these fund sources, is timing and ability to meet the grant purposes. So that's probably should be at the top of your list of looking at these allowables so that it's realized in the grant period. Can salaries for staff that spend 100% of their time at testing sites, can the full salary be charged? So this has to be supplemental. It has to be to the pre-award date. So if staff were spending 100% of their time before this grant announcement and pre-award date at testing sites, that would not be allowable. If it's a 100% time, there is allowability for partial funding for staff. So I would err on the side of that not being fully allowable the way you posted it, but there are some differences in this with staffing that we'll get full FAQ guidance there. But that term partial is not a word we inserted in that allowable. That comes from our state partners at DISHES that's approved. So we will get more written guidance there, but generally it's partial funding for staff and it's got to be outside their duties.
Exactly. Remember that the staffing time has to be outside their normal work hours. They may be spending 100% of their time working at a testing site, but if that's allowable work that's in their normal work hours, that is not the intent of this grant. And
so Corey, real quick, if you can add to that, if we've got a pre-award date, a of March 1st, any staff that were doing other activities before that date really wouldn't qualify here. Is that how we look at pre-award? Can you say a little bit more about that and this being supplemental?
It wouldn't qualify unless that was extra time outside their normal work hours. If they were doing overtime work or working outside their normal work schedule, normal work hours, then it might be allowable. But because of the way that the salary funding is worded in this grant, it has to be supplemental and it has to be outside their normal work time.
Can we use the funds for stipends for custodial staff and nurses, or a stipend for new nurses? I think currently stipends, stipend funding, I believe, is specifically not allowable in that form of payment. Damon, I'm going to lean to you on the FAQ if we have that posted with stipends. That's a form of payment folks are interested in, but I believe our requirement from DSHS is that stipends are not allowable. It would have to be some other form of partial payment. Is that still correct?
Yes, that is still correct. Yes, and that's also listed in our on the FAQ.
So it would have to be some form of payment for partial payment other than stipends.
Yes.
Good question. Do EGRA procurement guidelines apply? Yes, they do. You will notice in the grant application and the areas that Damon covered, as you click through the different pieces of guidance and assurances, they all link to EDGAR. For those of you that have applied to other grants, the format looks a little bit different, but the assurances, the requirements, the general fiscal guidelines that all incorporate EDGAR still apply, and especially for procurement. This can still be difficult with a timeline of in this nature, but procurement still applies. This does not necessarily change because the funding is not from USDE, because EDGAR is a compilation of many other federal requirements for any grant recipient. So you want to keep that in mind, and back to Corey's other point of timing of procurements and purchases and things of that nature, and probably also take that into consideration with any with your allocation amount. Can touchless hand dryers, soap dispensers, toilet flushing and water turn on counter under hygiene? Hygiene and cleaning supplies generally are not equipment, so we can get that a little more expanded, but touchless hand dryers, soap dispensers, it would have to be generally a supply as a consumable. So the dispenser, the dryer, toilets, those types of things wouldn't be considered consumable supplies generally. So this would be things that are used and or discarded after use for hygiene and cleaning supplies. Can we use the fund for technology staff to facilitate COVID testing? Again, it can be partial funding for staff under number 8. So this could be allowable. Again, these allowables, we will pose all these questions and answer them as directly as we can, but the allowability really needs to fit under those general allowable activities. And for all staffing, it's partial funding for grant-related duties. So it's got to tie to one of those activities to be a grant-related duty. Part-time temporary aid to support school nurse in addition of all duties associated with COVID-19. That could be, for partial funding, that could be allowable as well. But if it's to assist a school nurse in additional duties associated with COVID, it really would need to show these are supplemental and not just doing existing school nurse activities, which can be a little bit murky. There are many duties that a school nurse already covers. I know COVID-19 becomes a part of that, but would really need to justify how this is supplemental and really stick strictly to the allowable uses here in the partial funding. So it could put them in a situation where they may be put in part-time status to do other school nurse duties and support, and that wouldn't necessarily be allowable in this case. There is a fund code. I believe we have it posted in the FAQs. I know we have it, Damon. I don't have it off the top of my head, but I know we have fund codes.
I'll go ahead and I can get that posted. It's not on the FAQ to be updated, but I can go ahead and drop that in the chat before we get out.
Yeah, so Damon will look for that. We have those issued because of this grant application. We don't have the standard budget Excel that many are used to that would have these numbers, but we do have the fund codes, and those will be posted through the FAQ, and then Damon will share those when he gets those. Thank you, Damon. Can we use this fund for technology? We answered. The upvote caught up to me there. What about water bottle filling stations? There is really no area here that I see where this would be allowable for filling stations. It may not necessarily be a major renovation for a filling station, but it's not under the general allowables because we have, again, PPE, hygiene and cleaning, portable, HEPA, and other small items that may allow for air circulation, public health events, vaccine promotion events, COVID testing, CLIA, and partial funding. So I don't really see anywhere where that would be allowable. I'm not suggesting this, but those event uses of funds, there's some possibility of allowability for water at those events, maybe, but don't really see that as a full allowable, even if it wasn't major renovation. I'm not sure, Corey will always jump in here. So it's not so much about if it's major or not, it's just not an allowable use under those general allowables for water filling unless you could justify it to one of those promotion events potentially. Can we pay for the salary for police officers to provide security? Again, this would have to be outside their hours. If it's at a vaccine clinic, could still be pre-award and or current. With pre-award, if they're allowable activities, you could be engaged in those activities now and the grant funds could cover those costs later. But again, you want to be paying special attention to allowable uses of funds. You determine it's allowable and you're doing it in pre-award before you receive your funds. You find out later it's not allowable, then you could be in a situation there. But generally, it could be pre-award or current, any allowables for either. But for police officers, it would need to be partial and need to be outside their regular hours. Again, documentation there is going to be, especially the time and effort would be critical. If we submit our grant and then determine that we should have included a cost for pre-award, can we do an amendment for pre-award? So I'm gonna tap Corey to come in just a second, but say this is a hybrid application through Qualtrics, so we will allow you to amend. But in this case, Corey, because of the pre-award nature, would we still need an amendment if a pre-award amount changes in this Qualtrics system application?
Yes, if you didn't have the pre-award identified in the original submission, you will have to amend it to include that so that it's approved in your application. Otherwise, you could potentially have an audit exception from your auditor for it not being approved.
And so currently, if you've already submitted, you will receive, if you're a contact on the application, you receive a copy of what you submitted automatically from Qualtrics. You can use that as your baseline application, and then you could resubmit off of that with changes. We're also trying to develop a more streamlined system to amend through Qualtrics, but you would need to amend for pre-award in that case. But again, it would be through this application, so it wouldn't be through any other separate sheet right now. And if we have a new process for amendments to be received here, we will share that through the website. We provide up to 8 days of leave for COVID positive employees to mitigate. Would this type of leave be eligible personnel expense? They would have to be conducting grant related duties. So if this is just for leave, it wouldn't necessarily be allowable. I'm going to hit my kind of long pause in case Corey wants to add anything here, but to mitigate with this type of leave being an eligible personnel expense, if they're taking leave and it was their regular duties, it definitely wouldn't be allowable. You'd be covering their leave. And because this grant doesn't allow fully funded and it's only partially funded, I really don't see where that would be allowable. Because if you have a COVID positive employee who's a teacher, this grant can't supplant their salary not being there that day as a teacher. This is only for these supplemental activities and partial funding for conducting the duties. Can the funding cover MERV 13 filters? So I think we've seen this, and generally with filters, they're smaller items for airflow. We're saying yes. So air filters, if we haven't gotten it posted yet, we will, but those tend to qualify under for improved air circulation. The equipment that the filter goes in is not allowable, but we've gotten this question a lot. What about bus circulation? This is for portable, not portable because the bus drives it around, like portable, you could take it outside of the bus, types of HEPA fan filtration systems generally, or other smaller items. So this would be allowable as a smaller item. But again, back to that previous question, you want to be sure you're not gathering these or collecting a bunch of MERV 13s for later use. They need to be used, within the grant period. Can a software program to track testing be funded through the grant? This one would be difficult because it's not a clear allowable. And if it's a software that's used after the grant, because of the timeline as well, you'd really need the benefit of it in the period. So I would not say that a software program really fits under any of the allowables in the way that you've posed that question. That could potentially be covered through some turnkey testing services through another vendor, but I don't see where purchasing the software yourself would really be allowable. Damon, I may need some help on this one, but this says we hired an LVN to open a central testing center since she conducts testing every day for half a day, then supports nurses due to the heavy load. The wording release states outside staff's regular duties. So she was hired to do COVID testing and extra support. It looks like it's not allowable for us to fund the position fully or partly from this grant. So if this LVN is central testing center for the whole district, she's half day testing and then does support nurse clinics the other half of the day. That second half wouldn't be allowable. It would have to be partial funding. And I think we will pose this full kind of scenario question to our partners in dishes, but you couldn't fund it fully because it's partial funding for staff and it'd be outside their regular duties. I don't know if we have any other considerations there if you're seeing the question, Corey.
Yeah, I'm reading through it as well to make sure I fully understand. So I'm here as well. With this one, let's we'll reach out to our friends at Dishes, our partners over there, just because we want to make sure we give you the accurate response here.
I think there's a potential where part of it could be allowable based on the way it's split, but it's that other half. So it again, generally it could be allowable, but it wouldn't be to fully fund from the grant, definitely, because it allows partial funding, and we'll capture that and complete kind of response to that question. Good one. Each campus has provided a temporary employee to serve as an on-site substitute for COVID mitigation. This ensures we have adequate coverage in the classrooms. The positions are temporary, non-contract, paid by the hour. Is this allowable? If it's substitute, it's still covering normal duties, not supplemental. So I would say this is not allowable. It's potential partial funding to cover someone doing one of these allowable activities would be allowable, but you can't pay for a substitute to cover a duty that's not allowable. And the general duties of a teacher are not allowable here. And the partial funding would be conducting grant-related duties. So when you see grant-related duties for staff, it really has to fall under one of the first 7 of the grant. So again, this has got a little bit much more narrow window of allowability than you might be accustomed to with ESSER and other programs. Will the grant cover the cost of utilities at testing sites? There is no allowability here for utilities at testing sites. It could be a part of some turnkey testing, but that would really depend on the location. So don't see that as being something that's allowable. Again, we have this option for other allowable uses pre-approved in the application. If you feel strongly about this as a good and wise use of the funds, you could put it in the application and we would pre-review and approve, again, through our partners in Dishes, but does not appear that utilities are going to be a strong case to justify that as an allowable. We're looking to add a staff member in addition to our current nursing staff that would assist. Is this position that could be funded with this grant? Again, you could partially fund staff for conducting duties, but you couldn't fully fund. So it could be extra duties to cover this. There could be some partial funding for some part-time staff, but it has to be directly tied to this grant. And so it could fund some of that position. Can we use this to pay for electrostatic cleaning services, bus cleaning services? So again, when we go to cleaning, we have supplies. We don't have any allowability for services here. So I would say this would not be allowable for this grant. Again, supplies, if there are supplies in any of those types of cleaning, then those may be allowable, but the services themselves are not a clear allowable, not seeing a line to justify that in this grant. Is it necessary for pre-award costs to be EDGAR compliant? It's necessary for all costs to be EDGAR compliant. Again, that will be connected and stipulated throughout the application. And we have a larger question with a COVID case report from, I'm going to use names here, not to call anyone out, from Pam. If you can help me with that one, it's kind of dropped down, but we're planning to apply for this grant and had a few expenditures we needed quickly to address student safety at schools, air cleaners, etc. But we're not able to go out and bid on these items due to timely safety needs and nurse officers in large group areas. Our only expenditures purchased under most restrictive EDGAR considered. We do have a district policy about emergency safety needs and purchasing. Please advise. Corey, you may want to speak to emergency safety needs and purchasing, but your local policies and procedures and your EDGAR compliant procedures do apply in this grant. We'll state that though you need some of these quickly, air cleaners and et cetera that are portable, could be allowable if they meet that. But I think if you have a policy about emergency safety needs and purchasing, the non-procurement approvals and policies and ways to have non-competitive approval or emergency would apply here, Corey. Isn't that correct? If you had a policy in that case?
That's right. You can use in the Uniform Grant Rules, one of the reasons for using a non-competitive sole source procurement is due to conditions such as the pandemic. So public exigency and emergency. And if you can justify the need, fit that category, that would allow you to go ahead and go out sole source. And you also can consider that if your district allows it, doing this under the micro purchase type of procurement where you don't have as many procurement rules to follow. But definitely you could consider those two options.
And there is a link we share where we have some of those pre-approval forms for non-competitives as well, which is now going to be moving soon to an online form. So for those familiar, you can submit a sole source or non-sole source non-competitive. If you choose to do that, you're not required to, but you can submit those for pre-approval to TEA. Thank you, Corey. The first time you can draw down funds is January 14th, correct? All funds must be spent by March. Important to note, this is not a drawdown grant. We tried to do what we could in designing the grant payments here, keeping that timeline in mind. So you will not be in the expenditure reporting system. These grants will be paid through what we call through a voucher payment system. So as applications and amounts are approved, we anticipate making first round of payments for these by January 14th. Other than completing your application, making any changes that may be required, things of that nature, you don't go into a system to draw down funds. They will be paid through a voucher payment to you. So you won't go in on the 14th to try to draw down these funds. There will be a NOGA issued to you for documentation on this, but the payment will be not really an advance payment, but what we might look at as like an advance payment. You're not drawing down monthly or regularly for reimbursement here. We will make payments through a voucher payment in this system. So any references to that expenditure reporting system for this grant don't necessarily apply in terms of how you will be paid. Can we contract with an ambulance EMT services who will be on site at vaccine and testing events? So if they're providing COVID turnkey testing services and related support services, that could be allowable. And again, you just want to tie it to one of those enumerated allowables. If they're available and attend a vaccine promotion event of some kind, that could be allowable, or a public health event, it could be allowable. But again, it needs to tie to one of those allowable uses of funds. I thought exigency was tough. I'm going to say this: would pulse oximeters, I think I did it, thermometers and blood pressure cuffs for COVID symptom assessment be considered allowable? We have, again, services for COVID testing and vaccine promotion. Those don't really seem to fit an allowable purchase under this grant. Again, you want to go through the first 8 items. again, I could see potentially some of these allowables maybe fitting under a broader allowability of an event, but you would really need to justify it. So if there's a vaccine promotion event and those items are being used there, maybe they become a part of that event. But if you were purchasing those specifically for that event, that might be a little bit more of a stretch. But again, you also want to consider ability to use those for benefit in the grant period. But again, look very closely. I think the most flexibility for folks will be in public health events and vaccine promotion events. But the grantee will really need to document and justify that use of funds, and that may not be deemed allowable in a later audit or review. Is it possible to purchase shelves, chests, et cetera, for storage? That is not allowable. It's the PPE itself. So storage, chests, things of that nature would not be allowable. Portable HEPA, is there a list of approved vendors, or is any vendor allowed? Specifically integrated viral protection. I don't think we have or plan to post a list of approved vendors for HEPA. I wouldn't say any vendor is allowed. You still want to follow Edgar. There are certain providers and companies that could be disbarred or things of that nature, but we don't have an approved vendor list for this allowable item. Isn't that correct, Damon? All of our vendors are through testing, not any through HEPA or fan filtration.
That's correct. Yep.
Corey, I think we have a question and a slight plea here. We know the guidance of the grant is already written, but if there can be any reconsideration of allowing payroll for staff who complete testing and vaccines, not feasible to be done after their day. We are having to test kids throughout the school day, need to hire part-time outside workers to do this. This grant allows for partial funding for staff conducting activities. I don't believe it presupposes it's got to be only extra hours, but it could only be partial funding. So we'll get some more guidance on staff outside of staff already at your district. But Corey, I don't know if there's anything else to add there. We know some of these things are not feasible, but we've tried to negotiate as much flexibility as we can for these allowable uses. But again, this is a supplement, not supplant type of grant. It has to be beyond their duties, and it would not. We've looked at this many ways and many times. It just would not be allowable if it's within their regular duties. And those promotion events and public health events really are geared towards new additional events for vaccine promotion or public health. But we'll try to get some more guidance on what staffing will look like that we can post to the FAQ. Can we purchase equipment? No, equipment is not allowable. It is supplies. Are biohazard supplies and transport covered through this grant? Damon, I think we had some guidance on biohazard, but hygiene and cleaning are allowable. I don't remember if we've posted or had any specific guidance on biohazard transport. I'm not recalling anything.
It'll be in our new update, but yes, it is allowable.
Okay, so that will be more specific and in the FAQs.
Yep.
We have a purchasing procurement timing question. If a purchase order is generated before the grant is submitted, but the items are not received until after the application is submitted, would this be considered pre-award or not? Pre-award is anything up to the date you submit the grant. So it's considered pre-award if it's from that pre-award date to when you submit the grant. So pre-award is not based on when they're received. It's when you submit the application. We used to call it stamp-in date. So it's pre-award date up to date of application. So that's at the time you submit your pre-award is what you determine at that point from the time you submit the application. Corey?
It's not when you generate the PO, it's when you place the order. So if you place the order before you submit the application, it is pre-award. If you place the order after you submitted the application, then it's not pre-award. So it's not issuing a PO, because your process can issue a PO long before that order is ever entered or placed as an order. So it's when you place the order.
Since this grant is not a full year, Can we expect the annual report be more of a final report due after the grant ends? This relates to closeout, but we call it annual. We are trying for no cost extension. There's a possibility of that. We really don't know, but that report could be considered annual or final, but it would still be due within that closeout period. So it would be technically due after the grant ends for you on those activities, but within that 90-day closeout period. And Damon mentioned the reporting requirements. Reporting requirements for this grant can't necessarily be, those requirements can't necessarily be met by reports you're already submitting to other, I think there was a comment, we already submit this to our local healthcare. Grant reports are a requirement for this and can also impact your participation in the testing project. So it could be a final report if that end date, which we anticipate does, still stands, or an annual report, depending on any kind of extension. But you would look to that to be a final report, and it would be within that closeout period, going back to that timeline. And Damon's got the reporting requirements there. We are pretty strongly in the monthly category, but again, there will be monthly reports, but then we have potential for annual progress or closeout reports for the end of the year. Pay for salary for bus drivers who provide security. Again, it could be pre-award or current, but it would need to be outside the regular duties if you're using bus drivers, and then would need to document and justify that it's for for vaccine promotion events. If we currently do not have a designated staff member, can we hire someone for this since it will be supplemental? You could, but again, it's partial funding. So you want to be mindful of that. If they're conducting grant related duties for this, this could also be part of what's captured in direct administrative and indirect costs. But it would really need to fit under one of the allowables. So it would have to be someone really tied to those allowable activities. I think we did have, I may have missed it when it was posted, but Damon did post the fund codes in the chat. That'll also be in the FAQ for those waiting on that. What if we are only able to spend a partial amount of the money? So if the grant ends and you weren't able to spend all the funds, we would require, and we have language in the grant to require refund of any unused funds. So that lends itself to kind of monitoring and review and the financial monthly reporting that would be required. So there would be a potential to refund if it's not able to be spent in that time period. About 6 minutes. We'll still capture all the questions that are asked and work those through our FAQ process. Let's see if we've got any other statement. I'm going to take a pause and see if you you want to scroll through any of these. We're kind of down to the 3 and 4 votes to see if there's any you or Corey later on you want to cover that may not have made it to the top before we kind of take what others we have time for. I didn't know if there are any questions that you wanted to address.
I'm scrolling through now, just looking to see
okay.
if they've not already been addressed.
Hardware, laptops allowed to be purchased and used in vaccine events. So vaccine promotion events and communications is allowable. It's potentially allowable for those, but again, you really need to justify it that it was for that, and they would really need to be used within the grant period for vaccine promotion.
There was one from Aaron. And we've made this update. If it's not published yet, we can get that. But she says that for the application, allowable cost for number 5 is defined as expanding capacity to administer coronavirus testing to effectively monitor and suppress. But then in another place, it says vaccine promotions. We're going to update that. Number 5 should read vaccine promotion events and communication. So we'll make sure that that language is aligned across. I thought we'd already caught it in the application, but we might just need to, we might see.
Oh, yeah, and it's there. I think we just needed a refresh from the training materials statement. So that's a good one. And that is updated. Aaron had another good question. If we plan to claim indirect and or direct, what budget code should we include this amount under? You don't budget direct or indirect specifically to any one of those. You budget where it will come from. Direct or indirect costs that you use based off your policy and the rules and regs around indirect or direct admin could come from any one of those: payroll, other operating, or another code. So you don't necessarily bucket all of your admin costs in capital outlay. All of those 61 to 6,400 should add up to your allocation, and then you would be claiming a percentage of indirect. So generally with indirect, for instance, if indirect covered staff time, it would be a part of 6,100. But it could also come out of other operating. A portion of it could come out of 6,200. So you budget there. Your financial reporting may require you monthly or at the end to report in more detail, but you wouldn't necessarily need to budget indirect separately. I know some of our grant applications ask you to do this, but really you have an assigned rate and could claim that indirect up to that cap at any point if you were doing a drawdown. In this case, your indirect or direct admin could be budgeted throughout any of those payroll, other operating, just kind of depends on what your indirect cost or direct admin cost policies and procedures are. You likely see more of it in payroll, but that's not necessarily the case. So you don't want to look at it as where do I budget all of my administrative costs. Would paying extra duty pay to school nurses for after hours and cyber for COVID testing and contact tracing be allowable? It could be partial funding if it's for public health or vaccine promotion to work for COVID testing and contact tracing. Contact tracing could be a little bit of a stretch, even though those are important activities. They really need to be grant-related duties, and it would still need to tie to one of those. So it could be extra for school nurses outside of their duties, but it really needs to tie to one of those allowable activities. And generally those are the public health events, the vaccine promotion, but there is related support services to COVID-19 testing where you could justify some of that if it's outside of their regular duties. So we're still getting a lot of answers about the COVID nurse. Again, you want to see allowable number 8 and it's partial. It could be allowable, but it needs to be partial and tied to one of the grant duties. So for testing, it really most likely fits under allowable 8 and 6. It'd need to be partial. For screening, testing, or COVID prevention programs outside of the regular duties. So general answer is yes, it could be allowable, but it's got to be partial and outside of their normal duties. Will items need to be returned to HHS upon end of the grant? No, this is, this grant, you are a federal recipient of funds. All the inventory disposition and other rules of equipment and supplies still apply as they do under EDGAR. Our district is planning to have 2 mega vaccination clinics in November and December. We will be paying partial funding for staff who will be assisting. As we proceed with the proposed activities, your guidance is needed. Do you suggest we code the salary expenses to a local account and then adjust when the grant is awarded, or can the salary expenses be coded to ESSER 3 and then adjusted? Corey, I believe either of those is a potential way to do this. I don't know if you want to weigh in on coding salary for November and December allowable activities to local or ESSER 3 would work. But I think you made a comment you could foreseeably budget from either one of those and then reclass after the award, correct?
Yeah, he might have had to drop
off.
Yeah,
it's a good time to ask him when he drops off, right? If again, you want to align to a few things here, it's got to be allowable in either grant, but you could certainly, and we can put some guidance here. We don't necessarily suggest it's a determination, but we could put some guidance here that you could code to local. This is something that is done. It's still got to fit within all the other grant guidelines and the dates, and then adjust when the grant is awarded. You certainly could do that, and we'll provide some additional guidance there. Can the salary expenses be coded to ESSER 3 and then be adjusted? It would still need to be allowable in ESSER 3. You'd still have to go through all of those rules in that amendment process for ESSER 3 if you did it, and then adjust once it's awarded. So some things to consider in either one of those.
Matt, we're right at 12:30.
Yep, I just saw that question was a 3-minute one. Sorry about that.
No worries. We know that there are a lot of questions that we did not get to, but as we said, we're going to be updating our FAQ pretty thoroughly, and it's going to be more robust. We do have access to emails in here, so if we need to individually contact some people, we will. Thank you all for joining us. We encourage you, you have 3 weeks from today to apply, to definitely go to our website and to look at all the resources. They'll be updated. And we thank you for joining us. If you need anything further, you can email us at COVID case report. Matt, is there any way that they need to be emailing the grants department directly, or is COVID case the only one we're going to stick to right now?
No, right now we take all those through there, so you can find all the resources. But if you go through COVID case, because of the nature of this grant, you're going to get better answers because of some of the specificity of it.
Got it. Thank you all so much. Enjoy your Thanksgiving holiday, and we will be in touch. Bye.